This is the Doctor's Orders Radio Show with Dr. Kip Van Camp. Dr. Kip is a practicing physician with over 25 years' experience and 3 different board certifications in the world of medicine. Dr. Kip's general medical knowledge, coupled with his overall credentials, enable him to make difficult medical discussions easy for you to understand. Husband, dad, radiologist, professor, author, sought-after speaker, medical talk show host, Botox injector, and all-around nice guy. Here's Dr. Kip.
This is Doctor's Orders, the show where we explore any and all things medical. I'm your host, Dr. Kip. Welcome to my examination room on the airways. Many have claimed that under the Obamacare plan, the examination room just got crowded, with the bureaucrats. So picture that. So here's Obamacare. Many people think that the exam room just got crowded with bureaucrats like the Human Health and Services Secretary, Kathleen Sebelius, and the Director for Centers for Medicare and Medicaid Services. I want to make my examination room on the airways crowded too. I want it to be a crowded room. So welcome to all our listeners. Come on in. Let's engage in a medical discussion. This is where we talk about any and all things medical. Now, have any of you ever suffered from a sinus headache or from a chronic sinus infection? If you or a family member has ever suffered from this, you won't want to miss the show. What we're going to discuss today is something that has revolutionized sinus treatment. It's estimated that 32 million Americans suffer from sinus problems, and they say up to between 200,000 and 500,000 people undergo sinus surgeries every year. And many of these patients have such severe pain that they say, I don't have any choice, I'm going to have to undergo a sinus surgery. And then after they go through the surgery, they oftentimes claim that the pain was so severe that they said, I'll never do that again. I never want to do that again. So today we're going to discuss sinuses and what sinus problems are like, what the new surgery is about. And I've got just the man to explain this to us. I've got the right guest for this particular problem. I've got it with us today, Dr. James Gould. Dr. Gould is an otolaryngologist. He's a graduate of Washington University School of Medicine in St. Louis, Missouri. He completed his postgraduate training at Barnes Jewish Hospital in St. Louis, Missouri. And he is also the medical director of St. Louis Sinus Center. That's a mouthful. Dr. Gould, welcome to Doctor's Orders.
Hey, Dr. Kip, thanks for having me.
Hey, I'm really happy to have you on, and I'm excited to have this discussion because this is a problem that a lot of Americans suffer with. And I think, well, in fact, listen to this. This is a real patient. This is a story that a real patient has given me. This is what he said. I asked him to write this up, so I will briefly read this. After years of suffering from chronically inflamed and infected sinuses, I finally decided I'd had enough. I chose to do what 500,000 other Americans do every year. I had sinus surgery. It wasn't an easy decision. I had to balance my need for a fix against my fear of surgery, and research raised questions about the procedure itself, the surgery itself. But the man was so miserable, he says, my sinuses, which are the hollow spaces around the nose, had become so clogged with scar tissue and built up mucus from decades of infection and inflammation. His nose drained so poorly that he nearly every time he got a cold, he got a severe headache and a severe face ache, basically. And it got so bad he finally decided to have surgery. Once he had the surgery, he said before he had the surgery, he tried a couple things. He tried acupuncture. Acupuncture didn't work. He tried all the over-the-counter medicines and then the prescription medicines like decongestants, antihistamines, nasal steroids. Did you know that $5.8 billion a year are spent on sinus treatments, according to the American Academy of Otolaryngology? And he tried all these things and it failed. So he finally said, I'm going to undergo surgery. And then I saw this man and I said, did you try this new balloon surgery? And he said, I never heard of it. I didn't know anything about it. And I said, why didn't your doctor tell you that? He said, they didn't seem to know anything about it. Well, that's what brings me to Dr. Gould. Dr. Gould is a head and neck surgeon, an otolaryngologist. And is that a true story? Is that a common story you would hear from patients, Dr. Gould? Is that what they say?
Yeah, Kip, that story is a story that we hear all day long, every day at the St. Louis Sinus Center, so that doesn't surprise me at all.
Now, tell us about you and what your background is and what kind of surgeon you are and what you do every day.
Well, I as you mentioned before, I completed my training at Washington University in St. Louis, I have a special interest in rhinology and sinonasal disorders, and my practice really, in private practice now for 12 years, since graduating from Barnes, has really differentiated into a focus of sinus disease and sinonasal disease. And so I'm a general otolaryngologist, meaning that I do kind of all things ear, nose, and throat, but I kind of specialize in sinusitis.
What's the surgical background? What type of residency do you guys take?
You know, most of us across the country do 1 to 2 years of general surgery, and then we usually do 4 years of ear, nose, and throat training, which is a highly focused surgical specialty, which includes thyroid surgery, parathyroid surgery, sinus surgery, otologic or ear surgery, pediatric surgery, tonsillectomies, tube insertions in kids' ears and things like that. So that's pretty much what we do. And most of us tend to do a little bit of research along the way as well. And I spent a year doing a year of basic research at Washington University as well.
So talk to me about the frequency of sinus problems. You said that this is what you hear every day. And are the sinus problems usually this severe as what this patient described in the story I gave?
Yeah, well, you know, it's interesting. It's a great question. And usually by the time patients make it to a sinus specialist's office, they've kind of done they've kind of done everything. They've, you know, had over-the-counter medications. They may have tried vitamins and holistic remedies, and they've also usually seen their primary care doctor 5 or 6 or 7, 8 or 9 or 10 times and had multiple courses of antibiotics, prednisone or steroids. They've also typically had nasal sprays and that kind of thing. So by the time they make it to our office, they're usually pretty sick and generally pretty frustrated and really typically kind of desperate to get something done to find relief.
So the numbers are pretty accurate. 32 million Americans suffer from sinus problems every year?
Yeah, that's right on.
Okay. Very good. Now, so it's a frequent problem. You see this every day. What did people used to have to do and what made you as a surgeon say, okay, it's time? You know, one of the things, let me backtrack for a second. One of the things that doctors get stones thrown at them for is there are some people who say doctors are just ready to use the knife and to cut people open whenever they can, and that's all they're looking for. And I would say that's not a true statement, and I would guess you would agree with that you diagnose correctly, and once you make the right diagnosis, then you decide who needs surgery. So respond to that, and then tell me who needs surgery.
Yeah, you know, that's a great point and a great thing to talk about because there's a very fine line as a specialist because, as I said, a lot of times patients come in and they're extremely frustrated and they've tried all the medical remedies. So the last thing that a lot of my patients want is to say, well, here's some antibiotics and some nasal spray, come back and see me if you don't get better, because they've already tried all that. So most of the patients are looking for some sort of intervention, and I think you just have to do the right thing for the patient and do what's ethical and what's going to really be in the patient's best interest. And a lot of times that's surgical intervention, and a lot of it may just revolve around patient education and having the patient try more medical therapy if they haven't been treated appropriately prior to the visit to see us. So yeah, that's how I feel about that.
Well, we're already coming up to a break here in a minute, but we've got a couple minutes still. But I wanted to save the actual new procedure that you are engaging in, the procedure you're doing frequently in your office today. I want to save that for the next break because it's going to take a little while to discuss it. So before that, can you tell us what the previous sinus surgery was like? Yeah. Can you kind of describe that?
Yeah, let me talk about that. So previously, there were two options. You got medication therapy for your unrelenting and chronic sinus symptoms, and if that didn't work, you'd move on to have a CAT scan of your sinuses to look inside the sinuses and see what was going on in there. And if there was chronic sinusitis or chronic inflammation present, then you'd be taken to the operating room by a sinus surgeon, and then we would go in and surgically, with small instruments and small devices and little cameras and endoscopes and so forth, we would go into the to the natural sinus openings and surgically open those openings with cutting instruments, oftentimes creating very wide, large surgical openings in the sinus ventilation pathway. And that's really what's been traditionally done for the last 20 years, and we've all kind of accepted that that was the right way to treat patients. And there's really now been kind of a paradigm